This is an example of how miserable medically some men are, and they're not even complaining. Yesterday I saw a patient, 26-year-old. He came here asking for a vasectomy, but before I do that, I asked medical questions, and upon further questioning and taking history, and he wasn't complaining about these things. He had lower stomach pain, lower back pain, he had fatigue, he loses his erection middle halfway, he waking at night 2 to 3 times to go pee, and he wasn't even complaining. I told him, dude, you have a prostate infection and I have to treat you before I do a vasectomy, because then later on you're gonna have pain and you're gonna blame it on the vasectomy and say like, oh, I had these things since I got the vasectomy, I got screwed up. Like, no, we have to fix that. So he had a chronic prostatitis and he wasn't even complaining. He said like, so how do I know? It's like, well, when you have symptoms, you have to go to the doctor and ask. If you don't ask, no one would know. And honestly, you can go to some doctors, they will tell you nothing wrong with you, but it's not gonna cross me. I have to, I'm gonna find it. So I probably catch a prostatitis, prostate infection, one at least every week in patients that they don't even know they have it. So please, if you have these symptoms, go to your doctor, ask, look up, see, find a doctor that's familiar with these symptoms, so the symptoms are, this patient have, I'm gonna do again, the following: lower stomach pain, lower back pain, waking up at night to pee 2 to 3 times. He's 26 years old, losing erection halfway, fatigue, pain in the balls, and he thought it was okay. It wasn't. So I started him on doxycycline, Celebrex, tadalafil, and I'm going to see him back in a month, educate him more, tell him go read about prostate infection, educate yourself, and when you come back we'll talk more and I'll tell you what you can do to take care of it for good and prevent it from coming back, because this is a chronic thing. It's going to come back if you don't do something for it. It's not like a throat infection, you take antibiotics for 7 days and goes away. No, this is a chronic infection. You have to take care of it. You have to do something to maintain your body, prevent it from having it again. I'll see you next.